Hi, I'm Aida Diaz-La, Cilento, the Clinical Program Director for DOC, and I'm overseeing two facilities, Cybosky and Walker. Anxiety is quite common in children. It's normal to have anxiety for any one of us. For kids, it might feel normal to kind of like see them feel anxious when they're going to a new school or moving to a new area. Asthma is quite common in children. It's one of the most chronic and common childhood diseases. An asthma attack occurs when the airways become swollen and inflamed, and the lungs have difficulty moving the air in and out. And so when that happens, it mimics other symptoms and it can cause the asthma to exacerbate. So for children, there's tightness in their chests, there's some shortness of breath, they might be having some coughing and some wheezing. So it affects our clients in different ways. So obviously every child will have a different presentation. But for children with asthma and anxiety, it can cause them to have difficulty breathing. So the asthma can provoke the anxiety. So if they're having shortness of breath and difficulty breathing, they might feel anxious because of that. That can also cause them to have poorer or affect their academic standards. It can affect them at recess, socializing with their peers, because they may not be able to run around and participate in certain activities that other kids can. Stress is definitely something that can trigger an anxiety attack and even the asthma. And so there are stressful things in our kids' lives. It can have anything to do with, things at home, like maybe witnessing an argument with your parents, a death of a friend or a child, an illness, or even moving frequently to a new home or having to change schools very often. So it's important for us as therapists to be able to collect a good history. So being very detailed on what they're collecting from the family and the child, such as the intensity, the details of what's happening, how often it's happening in terms of its frequency, detailed symptoms, and also the underlying issues. So if a child can be very specific as to what is causing that or when it's happening, that's also important to be able to gather. It does affect more communities. Some communities more than others. So it has been found that lower socioeconomic status families are affected more than those that are not. And that can be determined by, the air that they're breathing in, depending on the neighborhood that they live in, probably more dust and just not healthy environments. And so also having limited means and access to healthy medical providers to be able to assess and treat their symptoms are necessary. So some of the symptoms that children will have in anxiety, to identify what anxiety is very irritated. They might be clingy with their parents or, with a guardian. They might feel irritated, very moving around a lot, so fidgety. You may have them say that their belly hurts or complaining a little bit more about not feeling well. Also, their sleep might be disrupted. So that can look like anything like waking up in the middle of the night or saying they're not tired or, not just being able to have a good night's rest. In terms of the treatment for anxiety, probably the most common and cliche, but really, really works is really good breathing. So slow, deep breaths. Oftentimes, like with children, it's, I would say try and think of putting your hands on your belly and actually, seeing their stomach rise and decrease. You can also tell them to kind of pretend or actually give them a balloon to inflate, which also kind of slows their breathing down. So those are a couple ones. Also kind of using yoga and different mindfulness techniques are very helpful for children.